There was never a point where I thought it was the perfect time. I just started with one little step and it started building from there. It only starts by doing instead of just kind of overthinking or thinking we'll get like less busy. Something will always come up.
Welcome to Inner Source. I'm Dr. Sandra Dreisbach. Whether you're just beginning to explore your inner landscape or you've been doing this work for years and understand that transformation is a lifelong journey, this is your space. We're diving into real conversations about personal growth, shadow work, and what it actually takes to create lasting change from the inside out. Because the truth, your most powerful healing tool isn't out there somewhere. It's already within you. Let's connect to that inner source together.
The information shared on this podcast, our website, and other platforms may be triggering for some viewers and readers and is for informational, educational, and entertainment purposes only. It is not a substitute for professional medical, legal, or therapeutic advice. While we explore topics related to altered states of consciousness, we do not endorse or encourage illegal activities or substance use. Always research your local laws and consult qualified professionals for guidance. The content provided is, as is, and we are not liable for any actions taken based on the information shared. Stay supported and informed, act responsibly, and enjoy the podcast.
In this episode, I talk with Emile Hung. You'll hear us converse about our interaction and relationship with one another. And we worked together on a 5-day email course on supporting shadow work as a shadow work facilitator. And so I wanted to take the time to make sure I support her in her work and give greater transparency to ghostwriters out there, because I feel like some of these things should be more transparent and people deserve to get more credit. But I also wanted to highlight she's actually based in Cuba. She's from Belize, and some of the challenges that we faced in the journey of even working together in the situation that she is in Cuba with periodic blackouts, with internet service interruptions that have been going on. We started working together months ago, and you'll hear about it a little bit about this experience. As someone who works internationally, I think it's really important to cultivate all of our awareness about the situations in the world and to find ways of, even when there are barriers, to face them and work through them together and address some of the harms that are happening in the world through relationship. I hope you enjoy this episode and see how amazing Ems is. I cannot recommend her more highly. She's very well organized. She's very well informed. She's also a nutritionist. And I hope you see that at the end of this episode, that working in relationship with Ems is definitely a positive experience. Well, welcome, Ems.
Ems or Emily.
I always call you Ems, so I don't even think about it.
Yeah, this is just Ems.
Well, welcome.
Yeah, I'm glad to be here. It's like my second ever podcast.
I find that an honor and a privilege, I really appreciate that, and I appreciate you taking the time. And maybe we should set people up right off the bat here and let people know that you're calling in from Cuba.
Yes, Havana, Cuba. And the first current podcast, I even did it from Cuba too. And we had all our like interesting ways of trying to get it to work, and that was really like a different like milestone there.
I really appreciate your resilience, and I know we should introduce you a little bit better for people. And I know I've given an intro to the show, but maybe you want to say a little bit about yourself and your work.
Okay, so I love building an educational email journey for women's health founders to help them scale their thought leadership, to nurture on autopilot, and to help bridge people who discover them for the first time to their offers and to ways of solving problems. That's me as a premium ghostwriter. And I would have to say I have two other identities.
No, give it all. Give it all. I think everyone should know about all the identities. Tell them about your nutritional blog.
Yes, that's it's a gradual growth. Because I've been amongst like thought leaders now that I start to have developed my own thought leadership as well. So nutrition no-brainer is what I would refer to as like the least you need to know about healthy eating. And I developed it because I was burnt out, and I realized like med school didn't really teach us like a way to think through this. Not even since like when I was studying, even like a primary school student, we had like health science class, but we never had a framework, something that you could easily think of, refer to, and ground yourself with. So I developed this no-brainer. It's 5 principles of how to eat healthy, and right now it's like I write a newsletter bi-weekly, and I write about how to make it actionable, and also debunking some myths. And I'm also developing a kind of like actionable community challenge so that you could like apply what you learned. So that's all in kind of gradual development. But I'll say I'm a final year med student, and I'm in my OBGYN or obstetrics gynecology rotation at this moment. This is my penultimate rotation before I complete general medicine, and I'm hoping to specialize.
And I should mention that, you're from Belize,
Yes, I'm from Belize.
but you've been in Cuba since 2017, is that correct?
Yes, that's when I first started my pre-med year, and after that, first year, second year, and then from third year onwards, it's work in the hospitals.
Now, I kind of want to pick up on something you went by quickly about your nutrition work and how you were led to do that work from burnout. As someone who also has experienced burnout, um, tell us a bit about that. So it happened during medical school?
Yes, so this is kind of some vulnerable territory, but I think I haven't really written formally or shared so much about it, but general, like at the end of fifth year, I think that was 2024, I think I reached the point where I could not continue. And it's not something that happened just once, it has been building up since third year, actually. I've reflected a lot and healed a lot since then. And it started in third year because of COVID. Like, COVID messed up the way we learned in school. There's a lot of restrictions. We didn't have a lot of practical. That ruined the experience of third year because third year is when you actually start going to the hospitals and everything. So with that fragmented experience and the frustration of delays in classes and the schedule and uncertainty, then I started to kind of just not enjoy learning or anything, or serving in the way the best possible self I could. And throughout the time, everything has been affected by COVID. There's always these restrictions. There's like a lot of expectations when it's a totally new situation, and it's very frustrating. So we don't learn as well, and then the professors are having expectations in the way they're taught, but it can't be taught like that anymore. So yeah, that led to gradual kind of frustration and struggles until, yeah, the end of fifth year. I was losing empathy. I knew I wasn't in the right headspace, and I knew I should stop because it's not right to serve others or patients when I'm not in the right kind of state of being. So I just knew I had to like take a break. And that was very hard to admit in a culture where it's very taboo to admit burnout and to take a break.
Well, especially in medical school, there's almost like a cultural approval of burnout. Like that's
Oh
part
dear,
of the
yeah,
process.
there's the kind of glorifying sacrifice, but
Yeah.
it's not going to last very long, and we already know that it's a huge mental health crisis among like both medical students and those who are working as doctors. If you don't take care of yourself, you will reach a point, and then very like tragic things can happen. It's never something that just happens once or is acute. It's more, it has been building up. And if you keep denying that you need like self-care, then it's just really like sad that certain things will happen because of it, right?
Yeah, and I think that's one of the reasons, like, I feel like we really resonated with each other. Um, and you can speak for yourself, of course, but, seeing what happens when that self-care isn't there, when your profession or the act of facilitating care or, actively or even in training can end up compromising both not just your care of others, but because of the care for yourself. You're learning about care, and yet the process of learning of care means I'm being harmed. Okay, so we just had a little bit of an interruption. Ems and I like had to take a pause for the internet, but we're back, and maybe Ems is a good opportunity to talk about the challenges of doing your work. You changed locations just for this call. How have you found the resilience for what you're facing right now?
So, that's true. Like, we don't have like normal Wi-Fi installed in our residence or in general, so we have to go to different Wi-Fi spots. And even there, sometimes it's not stable, and then you have to find another spot. So I have to figure out 3 different ways to get Wi-Fi to continue the work that I do, and also stay connected with everyone. So and I would say where I get the resilience is kind of like just having kind of a mindset. I think I have to admit it's an entrepreneurial mindset. It's the kind where despite all the conditions and everything, if you have a goal in mind, then it's it's all about figuring it out and taking ownership of what you decided you were gonna do. So then you kind of open your mind too of like, well, this doesn't work. Let's try something else. Let's keep finding solutions. Like you don't settle for like no, or like if the conditions don't work, well, that's it. You actually actively seek and figure it out, and then it sometimes just comes to you the different ways I've tried to make this work with Wi-Fi connection, because we did have an original one like by the residents that didn't work. So then I kept asking questions like, how do people like manage this? Then that brought me new answers and new like solutions for it. So it's all about being active in it and having this value within you of like being willing and open to figure things out. That's what this has kept me going all the time.
It's not just internet, it's also blackouts. And they say rolling blackouts, you don't know when they're gonna happen.
No. And then when it happens, you sometimes cellular data doesn't work, so you can't really text anybody. You can't call. It's kind of you're just kind of isolated. The hospitals at least have a kind of backup generator.
But I'm guessing that you can't run everything on the backup generator, just critical services?
Yeah, sometimes no. Like only the urgent cases get priority by that time, and so we have a huge backlog of certain patients that are admitted that need maybe an imaging thing or ultrasound and they can't do it, or blood transfusion they can't do it, but they have to kind of wait their turn, and so only the priority or urgent would go through there. And then the students will end up flocking to the hospitals to charge their devices because then you can't download the things you need to study, and you can't study all the materials that you need.
We've already talked about what you've handled for burnout, especially during COVID, being a medical student, and now with additional rolling blackouts and and still internet challenges, and you're doing an online business, and it seems like it's gotten more challenging there.
Yes, definitely.
What is helping you right now, other than being flexible? Clearly, you're being flexible and creative and innovative and coming up with new solutions because you have to.
Yeah, it keeps me that kind of muscle active of figuring things out and problem solving. I've had to like just develop programs that work here. The fact that sometimes I can't really follow up with like a sync meeting, then everything has to be asynchronous. And if there's clients that kind of aren't able to work like that, then it's fine because this is my reality. And so then I kind of find people who would understand, and that has worked out pretty well because we still get the same work done. It's just a different like mode of it, and I help them build what they need, the educational email course or other ghostwriting that I do, and it gets it done. That's the main thing that they need help with, and so it's like how you say different ways to do the same thing.
Yeah, and we've journeyed through this already for a period of time. Like we started working together last year. You helped to write and co-design the Shadow Work Facilitator free e-course. And and I love that you came from a very informed place on what it looks like to face challenging circumstances and burnout and finding healthier ways. And and I was literally in the process of my bankruptcy while we were building it.
Like we both thrive through the imperfect conditions. I think that's kind of the huge, huge like miracle there.
Resilience, yeah, the course itself is evidence of that because, like, I mean, there would be times where we couldn't meet because of a blackout.
Yeah. And we had to kind of send things to each other.
How was it for you working on the course? What did you like about, and you could say you don't like working on it.
What? No. I loved it because when I first came across you and we had our first coffee chat, like I always loved I always knew that there wasn't like forms of alternative medicine. That's what I've learned so far all these years that has not been covered. So especially things like the spiritual self or like the mental health, because I really think there is truth in some trauma being stored in the body that will manifest as certain symptoms. So it's a psychosomatic connection. And when you have like people like you doing this mission of what is shadow work, how do you navigate shadow work, then I feel like that still counts as part of healing, a part of like global the whole person's of health. So then I was excited to know more about it and to help you build it so that more people can learn about it, more people can realize there's this way of healing that could really benefit the rest of like their general well being.
Well, the honor and privilege was also mine because to have someone who I know you're still a medical student, but really are a veteran of challenging situations where, I mean, not just now, but because of COVID and being a medical student in Cuba, and you're not even from Cuba, you're from Belize, right? And there's cultural things, right? But it always got me here, even in the States, how medical professionals are trained under what I would consider toxic, unhealthy situations to work on learning about creating health. Right? It seems like the ultimate irony or something really toxic in the system, but I mean, maybe it's just because I 'cause I'm not a medical student and I'm not a medical professional, but I also appreciate the fact that you have that perspective on, some of the harms that can happen literally because you didn't have self-care or you have to take care of your own well-being and not experience burnout because you can see the real consequences when you don't do that work, whether it's mentally, physically, emotionally, or spiritually in terms of like shadow work. I mean, I'm curious if you have any like cases or particular times that really resonated for you, that really spoke to you about why self care is important.
When I finally realized that I was really at the kind of breaking point, so I couldn't move any further, I had mentioned that I was losing empathy, and you need empathy as a healthcare professional because patients are suffering and we can't always only think about ourselves. Sometimes they're in like a condition or a position that's a lot worse, like comparatively, and we can't just be cold and like only robotic about it. And so without that component that's super crucial, then you can't do your work. But if you yourself are in a state of not being able to like kind of hold it together for yourself, then that's kind of dangerous. You could be making mistakes. You could really harm the patient, like psychologically. You say something out of turn. Some people don't realize that they are kind of not helping the patient in that way.
Let's set off alarms for you that, like, I don't think I'm being as empathetic anymore.
Sometimes I reached a point where I, I couldn't like get myself to school. But I at least had someone with me. I think that helps. And realizing I just wasn't enjoying it, or the patients kind of complaining a bit more, or saying that they prefer a different medical student with them sometimes. But sometimes there's it's multifactorial why they would say that. But one of them is that me noticing that I think more of them didn't seem to be like well cared for. I would say. And kind of saying it too, like being vocal, like I don't feel like things are going well. So then it reflects on their progress because we kind of do a daily evolution. We visit them, let's say, in the wards every day. And if we don't see an improvement, then there's certain factors that go into that.
That makes a lot of sense, and I love even the elements of shadow work and self-awareness that you're pointing to, that, you noticed a change, right? And that alone requires a certain amount of self-awareness and a recognition of like, well, what do I consider to be, my inner alignment? Like what's my healthy sort of starting point? And this does not look like the Emily I love, right?
Yeah, it's being honest that I wasn't being the right kind of person to serve, and I needed to stop and like really evaluate and see what's going on and how to deal with that. And it was scary because I didn't have any tools to how to deal with it. It's not talked about.
Since you didn't feel like you had those resources already, right? And you weren't guided to them and you weren't told, this is what you do when you're stressed out or burned out or starting to feel apathetic or lack of empathy. How did you get led to the tools that you end up using? I know nutrition is one of the things you turn to.
I think I turned to who I looked up to a lot, my unofficial mentors out on the internet that share about productivity or self-development, and seeing how they go through similar struggles, even if they're not like in med school per se, but just challenging situations. I reached out to those. I listened to more of the podcasts. I searched if they've written about it. That's kind of the starting point. Having like, even if it's not like local like mentors, but knowing that there's like people who have been willing to share about their vulnerable stories and everything, and give you some hope and ways to like navigate. I think I ended up searching like kind of before I evaluated whether I'll really take the gap year. I've been reading up the stories of others, and that really helped too.
And I love that you say that because of course you're sharing your story. So you're in essence paying it forward to others who may be in a similar circumstance to you. So would that be your advice to someone else in a similar circumstance? Would you say like find others who've been through similar challenges, get inspiration from people you look up to even if you're not in direct relationship?
Yes, I would say find similar people, because if you just have people who haven't gone through it, they don't always give you the right context or the right ways to think through it. You need kind of someone who has been through it, has taken those steps, and you're probably a couple of steps behind them and wondering what's the best way to think through what has happened for them that worked or didn't work. But if you have someone, because I have tried to get help, but I realize if these people have not gone through the similar kind of mental gymnastics and the kind of culture of med school, and they don't know that context, it's very hard for them to give a bit more precise advice.
And what would you say about your journey to nutrition? Since I know you do have your newsletter and maybe people want to sign up and learn from you, what inspired that turn?
Part of my recovery, when I went home, I spent a year in Belize, and I I decided to find a job to kind of keep active in things. And at the same time, I was like, I'm very confused about like gym. I never really signed up to a gym or had a trainer before. I had one like in Cuba, but it wasn't very official or consistent. And so I decided like, okay, after work, I'm gonna go to this gym that was like kind of conveniently the nearest one to my workplace. And I think those were signs. I signed up, and this one was really special. This one is called Educo Gym. It's not like the other gyms, because this one includes like trainer plus like nutrition, the orientation for it and the accountability for it. So I'm like, okay, this has to be something I'll get into. And that's was really the first time I ever learned about the effects of eating high glycemic foods, hidden sugars, how we should prioritize protein, how like food affects your hormones and your metabolism. I didn't say it at the time, only the time when I applied all of the orientation myself, I realized this is like kind of the basis of like the prevention of so many chronic diseases, and also the basis of preventing symptoms from other conditions getting worse or feeling worse. So I was like mind blown. Like I learned this at a gym, not in medical school.
I'm a medical student. Why am I learning this at my gym about nutrition?
And it made so much difference because I found out I was eating terribly. That when I decided that I was burnt out, I have to just be vulnerable and share that I was eating the wrong things that made it worse, made the feelings go worse, made the depression go worse. When if I was eating right at the time, I don't think I would have been as in a worse state. Like I would have kind of found some calm maybe and think through it a lot more clearly. But I think getting burnt out and coming home and learning that, despite how like it could be criticized and taboo to do so, I needed to have gone home to learn it. there. Otherwise, I wouldn't have ever learned it. So it's a funny thing. They say difficult things we go through are blessings in disguise. It sounds cliche when I first heard it, but I literally lived through it. It's like I can't believe that I had to do that in order to learn the right things and end up in a like better place.
The wound is where the medicine is, that sort of idea, right?
Yeah, and because of that, I built the framework because I'm like, not everyone knows about this. Everyone's confused. I'm like, I need people to know more about it and have an easy framework that can be applied. So that's why I started Nutritional Breakthrough, and I'm always thinking about how do we make this a little easier? How do we make this more obvious? Because just from those little steps and following it could really make you feel so much better. If you're currently sick with anything, it's just prevents a lot of the symptoms from being like feeling so terrible. And that's what I really want. Like whenever I have patients in the future or anything, like I want them to know that. And so that's why I organized it well so that it'll be something very easy for them to have access to.
What inspired you from your home community to go into medicine, and where do you hope to go in the future, when you go? Because I understand you're planning on going back to Belize after you're done.
Yes. I've always been a very sickly child. I always had allergies to everything, the dust, the pets, changes in weather. I always end up in the hospital. My mom told me the story that I almost got like asthma or something, like or just some form of chronic respiratory illness. Like I was always getting sick, but it was a Cuban doctor that actually helped me like prevent that from happening. I don't know all the details; it's very fuzzy for me, but because it was a Cuban doctor and like that kind of made like etched in my mom's memory that and Cuban doctors are known to be very very skilled at like the clinical examination or applying clinical right ways of diagnosis because of well as I've learned here so far we do a lot of like the diagnosis and the treatment just by the physical examination just by the interrogation we don't always have the resources for imaging or the complementary things. So we always work with the experience of the repetition of knowing like what are the manifestations. And because of that, then this doctor probably knew like, okay, what exactly just from what I was experiencing. And but still I still ended up a lot of like times in the hospital and I was like, I want to, figure this out. I want to know why I keep getting sick. Something is not adding up or anything. And I always love science. So that's kind of what started.
Well, that certainly makes sense. But what's it like? I mean, like you say, like because the Cuban doctor had a different approach and was actually helpful for you, in Belize, or what was your experience at least, growing up there in terms of how people approach health and wellness, and even like the things that we've talked about: spiritual, mental, physical, emotional, like inner resourcing.
I think it's just that the traditional way of being medical doctors kind of looking at surface level and sometimes just solving things with pills. But the Cuban doctors always apply like years and years of like practice and with little resources. So we give treatment plans that are like the core and without needing so many like other maybe tests or anything, we already know because of the experience that what the form of the condition looks like. And so we know how to like address it. So it's and we also learn here like we call it bio I'm thinking in Spanish, but the not only the physical but also mental and social aspects of health and well-being. So we still ask about that, when we first meet a patient. We know that whole context because all that will apply.
Yeah, and I love that because, like, I mean, we're not we're not part people, we're whole people. As we wrap up our conversation, I was like, is there anything else like you want to share about you or your work or things that really help be an inner resource or inspiration for yourself? Because I mean, clearly you're a strong, independent, and resilient, creative woman. And I know even though you haven't graduated yet, I know you're going to be an amazing doctor, or wherever you end up leading. And I certainly personally really appreciated working with you and how you held space for me in the process of creating this email course on shadow work facilitation and the journey we went on together with that. All the while you're facing all these challenges and I'm facing these other challenges, and yet we still were able to co-create together.
I think that's the amazing connection we have. We can find ways to thrive even despite the imperfect conditions. I really learned throughout my time here in Cuba, throughout my burnout journey of healing, ghostwriting, and also organizing like Nutrition No Brainer, is that there was never a point where I thought it was the perfect time. I just started with one little step or one little like micro activity or micro action, and it started building from there. It only starts by doing. Instead of just kind of overthinking or thinking we'll get like less busy, we'll never, something will always come up.
Don't wait for perfect, you're saying.
Yeah, like there's just never a perfect time. I know it could be very scary. Another thing that helps is knowing that people have done it. So the who you look up to or who you listen to, the podcast or anyone you are inspired by, then that's proof that things could be done, right? So that's what will help keep you going as well. And I just wanted to ask you too, Sandra, like, what was it like working with someone like that has to like ask for so much flexibility that I had to be telling you that I have these conditions and we have to be working asynchronous sometimes.
I appreciate you asking the question. I mean, it's important to find the person who I want to work with, right? And I knew I wanted to work with you. When those things started coming up and honestly, like some people know, like it was all the time, right? And I knew I could trust you as a person. Right, I knew you weren't trying to sabotage things or cause intentional delays, or I didn't think you were lying about things. And I think that element of trust and relationship, that foundation we had in relationship, even in the few months, like when we were even delaying getting started, because we didn't start right when we met, that relationship allowed me to trust you, to be flexible, to be resilient, because I felt like we were in this together and we were going to get through this. We got this. I honestly didn't know how bad it was in Cuba. Now it's getting more in the news here in the West, but we were dealing with it for, like at least 6 months plus more, before it even was catching more news in the US, I think, and about some of the choices that are being made in diplomacy without making a comment on that, and wanting to work with not just the people who didn't have interruptions in their internet or with blackouts or who didn't have to deal with more challenging circumstances, because it didn't have to do with that. It had to do with who you were as a person, our relationship, and the quality of your work.
Oh, thank you so much.
Yeah, thank you. And thank you for coming onto the podcast and being willing to share.
Thank you too for the opportunity.
I want you to be seen. I know you're a ghostwriter, but I want you to be seen. I want you to get credit. You need to have allies. You need to have a team. Yeah, I contracted you, but like it's through mutual respect and partnership that we get the job done. Any last words for the show?
If you're going through certain struggles, like I think the main thing to think about sometimes is everyone goes through struggles. Try to kind of know that you're not alone in it. Everyone always has something, and like that helps like open your mind to like being kind as well. Kind to yourself, especially, because there's always this pressure these days to be invincible, but sometimes you need to give yourself compassion and to always think about the direction you're going, to seek resources and be proactive, especially when what's around you has not been helping. Then it's okay to seek outside of it too, and to get inspiration from people going through the same thing so that you get the right context and then you're less alone in it, right? And that's the conditions are never perfect. I've lived over 6 years with Cuba with studying medicine, and I just know for sure that there are no perfect conditions.
Yeah, I think that's a good lesson to take. It's not just don't try and be perfect, but also don't expect perfect conditions either. So thank you again, and I look forward to hearing more from you in the future.
All right, thank you too.
Thanks for being here with me today. If this resonated with you, subscribe wherever you listen and share it with someone else on their journey. And if you're ready to go deeper, take the free Inner Source assessment at innersourcepodcast.com. It'll help you discover exactly what kind of inner work you need right now and where to start. Until next time, remember that everything you're searching for is already within you.